So for many years, like I said, we've been teaching the medical massage. Shemaya was one of the founding teachers for LMT Success Group, and then she mentored myself and uh, a couple other teachers, and then I started mentoring teachers. And we've seen this company and this program grow a lot. Now, where we ran it about, I don't know, 5 or 6, 7 years ago, we had a lot of people saying, well, I'm 80% of what I learned in MMP I use, but there's this 20% of things like manual muscle testing and more assessment and spinal treatments, assessing the spinal movement and gait. What's the next level? Where do I go from the MMP? Now, we suggest you do medical for if you want to specialize in medical, especially, do the manual lymphatic drainage and cranial sacral, taping, cupping, all of those we use those every day. But when it comes to the assessment and taking your practice at next level and so-called advanced, when you really can look at, somebody walking or how they're sitting and how they're getting in and out of their car and be able to tell what needs to be corrected or what's wrong with them or where their symptoms are coming from. That critical thinking piece that you see instructors do all the time, it makes it look like witchcraft or, they can, fix a problem sometimes within a matter of seconds. So that's where we were asked to develop the next level of classes, which we call advanced. That is a subjective word. I guess it depends on where you are in your practice, but that's where the advanced class came from. So I started, Joelle and I started teaching advanced, and then just Ben brought it to that next level with his expertise in manual muscle testing, assessment, gait assessment. He's a running coach. He's, everything movement. So he's just brought it to that next level. So on that note, I will hand it over to you.
Awesome. Well, hi, everyone. My name is Ben Mickens. I'm based in San Antonio, Texas. I am a physical therapist assistant, yoga instructor, martial arts instructor. I teach Tai Chi instructor, movement specialist. I have a master's degree in exercise rehab. So I've studied this and I've taken it seriously. And what I've found is that it all boils down to the assessment because we repeat this over and over. If you're not assessing, you're guessing. So that is the component that we've tried to focus on with the advanced material in addition to building your practice and business. So as far as manual muscle testing, the reason why manual muscle testing itself is important is because if we do, and for example, I'll teach this in the class, we're going to learn an overhead squat assessment. That's kind of the gold standard assessment. And so when you have the overhead squat assessment, you're going to see different movement compensations. And then based on those movement compensations, you need to figure out, is the muscle not firing? Is that what's causing the compensation, or is it due to an overactive muscle? So that's where the manual muscle testing comes in. It helps you to differentiate. So it helps you to figure out which muscles aren't firing and contributing to the problem or the issue at hand. And so that's where we come into the terms of where we talk about how we need to energize the muscle. And so if we do a manual muscle test and we find that the muscle is not firing or it's weaker than normal should be, then that's where we indicate, and our indication is that we need to do some energizing techniques, either manually or with vibration, or if you're certified, to utilize exercise. And so then what happens is, if it's not a manual or a muscle issue, then maybe it's because of a length issue. So then we also incorporate length testing as well. So the combination of adding a length test with a manual muscle test will help you to determine which muscles are inhibited, which muscles are overactive and shortened and inhibited and lengthened. So that's the importance of the manual muscle testing.